so hello, dears. Okay, so welcome now to the last, hopefully the last part now of our lecture on hay infusion. All right, and we're discussing now mga medically important protozoa. All right, and for this part, we'll now go to the next group of medically important protozoa, and that is your flagellates. Okay, so flagellates. So it's still under phylum Sarcomastigophora, but its subphylum is Mastigophora. So as you can see, Sarcomastigophora, by the name itself, is a combination actually of two phylum or subphylum. You have the Sarco, diba? Sarcodina, as what we've discussed last video, which consists of your amoeba, and the Mastigophora, which consists now of your flagellates. Okay? Alright, ayan. So both of them are under one big phylum, which is Sarcomastigophora, and then subphylum Sarcodina, amoeba, Mastigophora, your flagellates. Okay, alright. Now, by the name itself, flagellates, diba, as mentioned, are medically important protozoa. They are subdivided into groups depending on their organs of locomotion or the organs that they use for movement. And for flagellates, by the name itself, they use flagella. Flagella, or a whip-like structure, whip, latigo, whip-like structures known as flagella in their trophozoite form. Now, all of the flagellates, no, all of the flagellates in their life cycle have a trophozoite form, but not all have the cyst stage. Okay, there are some flagellates that do not have the cyst stage. Okay, all right. And the typical intestinal flagellate life cycle is also similar to the amoeba. All right, in terms of mode of transmission, their stages, and all that. All right, and some of the most common other common transmissions, not only as ingestion of fecal oral. It could also be sexual, again, and you have vector-borne or through insect bites. Okay, and we'll not discuss that. Usually, the vector-borne flagellates are the hemoflagellates, those that can be found in the blood. All right, and we'll discuss that again when we discuss blood specimens for parasite examination. Okay, all right, so we'll focus more on intestinal flagellates and sexual or genital tract na mga flagellates here. And again, first we'll discuss the very popular, all right, our bestie, charot, and maybe the favorite of you, some of you, during our virtual microscope, Giardia duodenalis, or its other name is Giardia lamblia, Giardia intestinalis. Actually, it differs on the references. I don't know what name ang ginagamit ni Ma'am Bernal in the lecture, so I'll just ask her para consistent. So I just use Giardia duodenalis, but it can also be used as, you can also call it Giardia lamblia, Giardia intestinalis. Call it what you want by Taylor Swift. Charot. Okay. Infective stage, cyst pa rin. Diagnostic stages, the trophozoite and the cyst. And the mode of transmission, still the same with your entamoeba, ingestion of contaminated food and water with the cysts, or pwedeng person-to-person contact through anal oral sex. Okay. Or via the fecal oral route. That is why its disease is known as giardiasis, traveler's diarrhea, or gay bowel syndrome. Ayan, please take note. Gay bowel syndrome. Why? Because of oral anal sexual practices. Diba? Usually, our LGBT friends, no, the homosexual friends natin, practice oral anal sexual practices. That is why it's also named after the disease gay bowel syndrome. All right? Okay. Ayan, okay. And this disease causes steatorrhea. When you say steatorrhea, there is increased amount of fats, okay, in the stool. So, ang imong stool, magbula-bula, all right? There are a lot of bubbles, medyo oily siya, all right? So, there are a lot of fats in the stool, steatorrhea, all right? And according to Bailey and Scott's, Giardia lamblia duodenalis is the most common cause of intestinal infection worldwide. Ayan, the most common cause of intestinal infection worldwide, according to Bailey and Scott's. And only protozoan parasite that resides in the small intestine. Because again, dito siya makuha nourishment. Most of your other protozoan parasites, your entamoeba, no, they reside in the large intestine, in the colon. But for Giardia, it resides on the small intestine. Alright? Okay, ayan. So why am I, introducing these mga sentences, guys? Because inana po ang questions of boards. Like, this is considered to be the most common, word for word, ang questions of board. Most common cause of intestinal infection worldwide. Nako, press the buzzer. That is Giardia duodenalis or Giardia lamblia. Alright. For diagnosis, again, still the same stool exam or wet preparations. Duodenal aspirate, meaning sa duodenum, kuha kag aspirate there. Of course, entero test, string test, diba? Recall in our first mga first few lectures, di ba, on specimens for parasite examination. And of course, so the same serological test using your serum and testing for, again, antigens, antibodies. All right. Okay, now we go into the life cycle of Giardia. As you can see, still the same with entamoeba. The person ingests the cyst, either again through water, food, or hands na wala na properly wash, okay, with the cysts. Ayan. And again, still the same, cyst becomes a trophozoite, and the trophozoite divides longitudinal. When you say longitudinal sila mo divide. Okay, cute kayo, di ba? And now it becomes different. A lot of trophozoites na, and then of course, balik na po sa cyst, di ba? Parehas sa entamoeba. Okay? Alright, ayan. Now we go now to the different morphological forms. We'll start first with the cyst. Ayan. So that's the cyst of Giardia, no? Theoretically looking, all right? And this is the real appearance, no? Under the microscope. And the cyst is described as ovoid in shape, as you can see, oval, no? You have 2 nuclei, duha lang if immature, and 4 if it's mature. And lastly, you have the median bodies, ayan. Rod-like structures pa rin that help in the functioning. Usually, parang nuclear material pa rin ito. 2 siya, again, kung immature, and 4 kung mature. Same with the nuclei. Alright? Ayan. So, that's the cyst. So, just take note of the structure and the nuclei because that will help you in the identification. Alright? Ovoid in shape. And whereas for the trophozoite, again, very characteristic, very distinct of the Giardia, di ba? Yes. The one that I let during our virtual microscope din, di ba? Trophozoite is described as spare or teardrop shape. So, mura siya luha. Falling leaf motility, yes naman, di ba? Yes, falling leaf motility with 4 pairs of flagella. So, according here, 4 pairs. 1, 2, 3, 4, 5, 6, 7, 8. Ayan. So, 4 pairs man. So, 8 flagella all in all. And again, unsay ang characteristic motility? Falling leaf. Nako, press the buzzer. Yes. Okay. All right. Ayan. Bilaterally symmetrical, meaning if you divide the 2, they look the same. All right? Bilaterally symmetrical, containing 2 ovoid. Ayan, this one. The one that appears like eyes. That is now your nuclei. Okay? All right? Equipped with a ventral or sucking disc. No? If side view, this is the sucking disc. Yeah, sana all my... joke ang bastos. All right? Sucking disc or ventral disc. This is what Giardia uses to attach the small intestine. And this is the point of entry where the nourishment, no, from the intestine villi, small intestine villi, comes or enters. So sa sucking disc, so musak siya. Sana all. Musak siya sa imong intestine. That's why it produces a lot of fats. Kaya musak siya. So mga guba ang cells sa imong intestines, no. So may mo siyang fatty, so muna mo produce siya fats, muna nice steatorrhea. All right. Okay. And lastly, of course, appearance. As mentioned, old man's face. Old man with eyeglasses. Old man appearing with eyeglasses. Or someone looking at you. Diba? Very creepy. Very stalker-ish. According to Bailey and Scott. Yes. It has 2 eyes. No? Again, someone looking at you. Or again, old man's wearing glasses. Okay. All right. That's for Giardia, Lamblia, Giardia, Duodenalis. Okay. Now, we go now to the next flagellate, which is your Trichomonas vaginalis, okay? So, by the name itself, Trichomonas vaginalis. So, where do you think siya makitaan? Sa vagina, okay? Alright. Infective stage, trophozoite. Ayan, so dili na cyst. Diagnostic stage is still the same, trophozoite, because this is one of the flagellate species na walang cyst. They don't have any cyst stage. Trophozoite lang dayon. Alright? Please take note, the Trichomonas species, they do not have a cyst stage. Excuse me. They do not have a cyst stage, only a trophozoite stage. Okay. All right. Mode of transmission, of course, sexual intercourse. And the disease that it causes is known as trichomoniasis. Trichomoniasis or your ping-pong disease. Ayan. So, ano mang ping-pong, sir? Ping-pong? Okay. All right. Sige. We'll discuss later. All right. For men, it's persistent urethritis, so inflammation of urethra, symptomatic men. And for women, it's persistent vaginitis. And so vaginitis sa women, they produce a yellow to green discharge daw, guys, that is foul-smelling. Baho, mabaho. Foul-smelling. Alright? Mabaho na green to yellow discharge. Okay. Alright. And aside from that, it's considered to be the primarily the non-viral sexually transmitted disease worldwide. So it's the major cause of sexual disease worldwide, primarily the non-viral sexual disease worldwide, Trichomonas vaginalis. Okay, and it causes punctate hemorrhages of the cervix, which leads to description of the cervix of women having this as strawberry, appearing like strawberry. Later, we'll discuss. Okay, and how do we diagnose? Wet preparations pa rin. We make a smear out of vaginal or urethral discharge. Urine also can be found, Trichomonas vaginalis, Tropotrophozoite, and prostatic secretions in men. Because your Trichomonas vaginalis in men, they like to stay in the prostate. They like slightly alkaline na pH. So, ganun sila medyo basic ang pH. Alright. And of course, gold standard is culture using Diamonds medium. Alright. Now, ano siyang ping-pong's disease? Why is it called ping-pong's disease? Because usually, men having Trichomonas vaginalis, they are asymptomatic, meaning they do not feel anything. So that's why, because they don't feel anything, so they can have multiple sex partners. Or when they have a sex partner, so they can transmit the Trichomonas vaginalis there, and then the female also will now develop some symptoms. But dili tag doon kay maybe they will wonder like, where did I get this na my partner is not symptomatic. So they then continue to have sex. So the female, the trichomonas from the female goes back na naman to the male. And then ping pong. Ayan. So balik-balik na lang sila. Alright? Okay. Because again, generally, trichomonas infections in men are asymptomatic. They do not exhibit symptoms. So men will feel like, nothing's happening. Okay lang, wala lang. Alright? Okay. So it's important that if one female has trichomonas infection, then all of her partners, if marami man, wow, sana all. If marami, or nasa sexual partner, if only one, monogamous, then that partner should also be tested for trichomonas. Okay? Because again, it could be that the partner is not feeling it. Okay? Because again, males are usually asymptomatic. Alright? So I hope na gets lang why it's called ping-pong disease. Ping-pong. So balik-balik lang nila. Alright? And this is the appearance of a strawberry cervix. So this is the cervix, guys. Alright? And the red one are punctate, meaning tuldok, punctate, hemorrhage. Ayan. And this is the cervix of females. So it looks like a strawberry, diba? Alright, strawberry cervix. Okay, alright. Now we go now to its appearance. This is the trophozoite of your Trichomonas vaginalis, and this is the real thing, okay? So described as ovoid, round, or still the same pear-like shape. Rapid jerky, alright, magsige kurog-kurog. 4 to 6 flagella, gikan from the anterior. So, from the front, nag-originate ang flagella niya. Right? 4 to 6. Okay? And undulating membrane. So, your flagellate or your trichomonas has an undulating membrane, guys. Ayan. So, undulating membrane which helps in the movement pa rin. And the length is just half of the body. So, half of the body, dyan lang, kutob, or it's until there only, ang undulating membrane niya. Alright? Half of the costa or body. Okay. Alright. Ayan. So that's for the Trichomonas vaginalis. All right. And now we're now in the last group na gyud of medically important protozoa, and that is of course your Silicates. Okay. Again, this is under phylum Ciliophora, and by the name itself, what do you think is its organ of locomotion? Cilia. Okay. Cilia are short extensions of the cytoplasm all around the body. Again, for movement. And the ciliates, they have two different types. You have the macro, big nucleus, and the micro, small nucleus. Okay. And of course, under this group, there's only one medically important ciliate. Alright? And that is your Balantidium coli. And it also, at the same time, is the largest protozoan parasite affecting man. Okay. Alright. Ayan. Now, we go now to Balantidium coli. Alright? Infective stage, still the same is cyst. Diagnostic stages, trophozoite or cyst. Mode of transmission, ingestion. But this time, please take note, feces of pigs. It could be that the food or water is contaminated with feces of pigs. Ayan. Because again, they are known to be reservoir. Diba? Recall, reservoir, meaning the parasite lives normally there, but they do not cause infection. Just a carrier or a reservoir. Alright? Reservoir hosts ang pigs for Balantidium coli. That is why, very common, I will not forget this question in my exam in internship ba to? Case study. A farmer is a pig hoarder or a pig caretaker, And then nag-develop siya og diarrhea, nag-develop siya og like nagsakit yung tiyan and all that. So what is the possible parasite? So when the questioning is like that, na ay pigs, no? And then the symptoms is like intestinal, like diarrhea, abdominal cramps, abdominal pain, then that's most probably Balantidium coli. Alright? Okay, so nanay mga notes dyan, take note, alright? And of course, the disease that it causes is Balantidiasis. Balantidiasis. Symptoms, it resembles amoebic dysentery. So, loose stools, sige kalibanga, liquid ang stools, sakit ang tiyan, diarrhea, like that. And abscesses and ulcers may also form in the large intestine. And acute infections, up to 15, di ba? So, sa gunson ang pagkalibang. So, liquid stools, 15 liquid stools containing pus, mucus, and blood. Ayan. So, that's for Balantidium coli. And for diagnosis, it's usually wet preparation. So, stool examination and permanent stain smears. Okay. And we go now to your life cycle. Still the same. Ingestion, food or water, usually ang cyst. Alright? Then becomes again a trough. And still the same. So it's very, very straightforward. Okay, very simple. All right, now we go now to the cyst, Balantidium coli. So this is the theoretical, this is the real thing. So as you can see, it's really big. So it's described as subspherical, so it's not totally spherical, or oval in shape. A double protective, so as you can see, the wall is thick, double protective cyst wall surrounds the organism. Mature cyst may also lose the cilia because young cysts can have cilia there na small lang, all right? Okay? And when you stain it, only the macronucleus can be seen. So, because it's big, all right? While the other structures cannot be seen, all right? Okay, that's for the cyst. And lastly, for the trophozoite, ayan, so that's the appearance, di ba? Again, I've let you see this in our virtual microscope activity, di ba? Trophozoite, the largest protozoan again, known to humans. Ovoid to sac shape, ovoid or sac, para siyang sac. So, parang inana, marag tear pa rin, ana, sac. Okay? Tapers at the anterior end. So, meaning, niwang siya sa front, okay? It's thin at the front, and then becomes big at the back. Okay? Alright? And rapid rotatory, rotate, boring. Okay? Boring motion. And small dot-like micronucleus, and large kidney bean shaped. Ayan, di ba? I've already shared that. Kidney bean shaped, macronucleus, Balantidium coli. Alright? Please take note. And this arrow here, guys, is the cytostome or the mouth of the trophozoite. Primitive opening. Parang mouth niya for eating. Yan. Okay? That's the cytostome. Again, kidney bean shaped macronucleus. Nako, press the buzzer na, guys. Balantidium coli. Alright. Okay. And that's it for our lecture on hay infusion. So, di ba, medyo nataas lang siya because I've introduced some medically important protozoa. But again, that's not all of the protozoa, not all of the amoeba, flagellates, just some of the most important. And some that you can encounter when we examine mga stool specimens in the laboratory. Okay? And don't worry, you will discuss more in your lecture. So I'm just parang briefing you guys, no? Priming you for what you will encounter in the lecture. So I hope na-appreciate rin ninyo to. But anyway, yes, so that's all. So for our protozoa, as you can see, the life cycle of our protozoans are very, of what we've discussed, they're very simple. No, you ingest the cysts, then they infect you, and then pass on the cysts, and then goes on and goes on. There are some protozoans, however, like your sporozoans, that have much more complex na life cycle. And also your flagellates in the blood, hemoflagellates. So again, we'll discuss that in the later part of the SEM. All right? But for now, that's it for hay infusion. So I hope you learned something today and that you were interested or you were happy or captivated by our lesson. So if you have any questions or if you have something that you don't understand, feel free to PM me or chat in our group chat and I'll respond ASAP. All right. So thank you so much, dears, for watching and listening. Have a great day and keep safe.